Welcome to Becoming Parents Podcast. I'm your host, Jennifer Campbell. I'm a doula in Washoe County, Nevada, a Medicaid provider, a lactation educator, childbirth educator, and mom of 18. You can find me and connect on doulainreno.com. Remember, give a shout out to those who are brave enough to share their stories with us on how they have become parents. Let's dive in. Welcome to Becoming Parents Podcast. I'm the host, Jennifer Campbell. Today, doctor of Oriental Medicine, right? Did I get that right? Woo! And I know you're local, so this is super fun. I want you to jump in and tell me about the journey you had to try to become a parent.
Well, it all starts back in my 20s, and I thought I was going to be an artist, and I kind of got drafted into being a healer. So I got my bachelor's in environmental studies, and then I immediately went to massage school. And I ended up doing that for 15 years in 3 different states, bunch of towns, had a bunch of businesses, loved my profession, and I finally after 15 years, which is a lot longer than most massage therapists last, I wanted to go deeper into the medicine. So I went back to school, got my master's in Oriental Medicine in Boulder.
All right.
And and just loved my career. So I was always in the point of like trying not to get pregnant until I hit my late 30s in acupuncture school. And I was like, oh my gosh, the clock is ticking. So I didn't have a partner and, trying to do all this it was a little bit backwards, it seemed like to me. But in retrospect, I really feel like my whole journey, which ended up in, I did marry a man and we had, I did get pregnant and then I lost my child in the first trimester. So then that was like, oh my God, the worst thing that ever happened to me. And the whole sense of failure and my body failed me and all these like really primal things come up as a woman when this happens to you.
Yeah.
And I worked through all of it. I didn't just like immediately, go out and try to get pregnant. And I'm so happy because I worked on this theory that's like you have to cultivate the soil. You have to have a body that is actually receptive to being pregnant and to bringing life into the world. So it was a much different approach from a Chinese medicine perspective and like taking herbs. And I went all through this whole journey with different acupuncturists and reading like crazy and studying the Weston Price Foundation ancestral diet. And I even, went through adoption trainings and,
Wow.
I went the whole gamut. And then I popped out on the other end and was so grateful that I have little nieces and nephews that I can be the fun aunt to.
Yeah.
And I have helped so many women get pregnant.
Do
So,
you, I mean, you're right about the soil, I feel like. And the miscarriage, that's traumatic. And
yeah,
then, like, you tried lots of different things that kind of square peg, round hole type thing, I'm guessing, which can be
yeah,
really devastating. How did
yeah.
you, in that situation, how did you keep a positive attitude through all of that? Because the loss of a child, that can be really traumatic.
It was. And honestly, I still have little triggers that come up. I've done a
Mhm.
lot of spiritual work with this, a lot of praying and meditating, and just also being of service. I always think that everything that happens to me happens for a reason, and I try to dig deep and really study and learn and then offer it to my patients and to the people in my life. So that's where I've come to this kind of peace with it is that um, I have been a parent in other lifetimes, and actually my husband and I got a reading, astrology reading when we first were together, and this is my second husband, and he and I have raised many children together. And, sometimes these little tidbits of information, they either help you or they don't. Sometimes they're just
Mm.
kind of random bits of information. Other times you're like, oh, okay, well, I guess it's okay. I'm okay. It's all right to be me in this lifetime and have all this knowledge that I've accumulated on pregnancy and every stage and diet and what to
Yeah.
do in emergencies with acupuncture and pregnancy and all these things that I really would love to dive into and tell you and your listeners about.
I want to dive into that because I think it's so impressive that, we all have to make decisions about career and family. And I gave up a career to have a family way
Right.
back in the day. And there's a part of me, I love my family, I wouldn't trade it for ever anything. That doesn't mean that I don't think about what would have happened in that one moment. It's like the Mr. Destiny movie, like at
Yeah.
this very pivotal moment, you went that way and you could have gone that way. And what would that have looked like? And so I think we all need to make those decisions. And
Yeah.
there's nothing wrong with it. And you
Yeah.
did. And then, it's not static, it's fluid. This
Yeah.
always changes, even your career. I want to
Yeah.
talk about how you added on and changed things within being a doctor of Oriental medicine. Like that was a process too for you, and how your fertility issues changed what you do and how you do it.
Yeah. So first of all, I think I just want to backtrack to what you
Yeah.
said a little bit. I think there's a flaw with the feminist movement because it sets women up for failure. And I follow the work of this woman, Kelly Brogan, who's a psychiatrist, and she really talks a lot about how we can't do everything perfectly. We can't be super mom, super career woman, super wife, have the perfect house, all these pressures on women.
Yeah.
So there is nothing wrong with choosing a career, and especially if your career is something you're really passionate about. And there's nothing wrong with choosing to be a mom and
Yeah.
being a full on mom that stays at home. That's a beautiful thing. And it is a career. And it's something that needs to be more valued in our culture.
Oh, I
So,
hands down agree with that. I mean,
yeah.
I became a mom young intentionally, and I was a stay-at-home mom, or I worked jobs where I could keep my first daughter with me, and then I had subsequent kids. So I stayed home and did foster care for 12 years. And then I
Wow.
went back corporate and I did that for a decade. And then I realized I prefer working for myself. And
Yeah.
I've had 10 years of being an entrepreneur. So, I mean, you can live lots of lives in your work. And
Right.
holy cow, I look at my daughter staying home with her kids, and I did it for 12 years. And I'm like, how, how does she
Yeah.
do?
It's
It is
hard.
a lot. It's a
Yeah,
lot.
it
So
is.
I do agree, but I also think that we have to make decisions on directions we go. I think you can have it all. That's a lot easier now than it was back 32 years ago when my first daughter was born. We had
My
no.
number, yeah, my number one piece of advice to women is
Yeah.
start young. And
Mm,
when I was in my 20s, and I didn't want to have kids. I was off adventuring, I was going to school, I was traveling, I was, exploring myself and developing as a person. And actually, most people don't know that your fertility starts dropping at age 32. So
yeah.
really, the 20s are really the peak time. It's the easiest on your body. It's the easiest. And with all the microplastics and all the toxins, we are basically swimming in a toxic soup. And it is really negatively affecting our fertility. So for women, it's getting more and more difficult to get pregnant, but it's also affecting men. And all these plastics and chemicals are feminizing men. So that's something
Yeah.
that's not really talked about is like the testosterone levels and the sperm count and everything dropping. And so it's actually, I believe that it's actually a radical act to have children now. And it's
I
really, yeah.
I'm so glad I'm not in that I had kids when I had them.
Yeah.
I'm so grateful, honestly. Tell me about the changes in your career and how much your fertility, the issues you had with fertility affected what you do. And I cannot wait to get to, like, I love ending on happy notes. I can't wait to get to the success stories that you've
Yeah.
had. But jump in
Yeah.
with, because that was that you took us through pretty quickly what you've done, but you've done a lot and I want to celebrate that.
Thank you. Thank you. Yeah, so after this happened, let's see, I was around 42, and I just really started delving into the work of Weston Price, who was a dentist in the 30s. And he
Okay.
traveled the world looking at children's teeth and seeing who had the best palate, the widest smiles, the least cavities. So this ancestral diet is based on, many, many different cultures and looking at what is actually the most healthy. And
Mm.
he also started the Weston A. Price Foundation, which is an amazingly generous group. Their website really, really, really highlights what you need to eat. And it's a lot
Oh, okay.
more, yeah, what you need to be eating to get pregnant and to like we were talking about, to prep the soil. And so it's a lot more fat. I mean, saturated fat, something that's demonized in our culture, and it's actually what we
Yes.
need. We need that, especially as women. And so this whole thin and anorexic look is actually really toxic, and it's not something that's very good for women who are trying to have babies. So that's like the first is like diet. And then it's about stress. And like, one patient I had, we have something called liver chi stagnation, which is someone whose emotions are not flowing. The liver likes to like flow up and out and have this free flow of emotions. And she was very stuck. She had PCOS, and every doctor and specialist had told her that she would never have children naturally. And so there was this physical thing that was happening in her body. And then there was also this emotional component of this kind of rage and anger and just this desperation of being told, I'm never going to have children. And so I actually worked more on just like helping her calm and, get to a place of balance in her body emotionally.
Yeah.
And that it's both. It's like the chicken or the egg, which is more powerful, working on the body and getting the body all balanced, or working on the emotions. And I work with both. I mean, really separate one or the other. And she did have a natural pregnancy, and it was
Oh, all
such a
right.
huge delight to see her. I don't know, I was in some store somewhere, and I see her and her husband with this little baby in the shopping cart, and my heart just exploded. I was like, and then she got pregnant again, too. So, yeah, that was really, really exciting. And yeah, so I've just studied everything about like pregnancy, like every stage, every trimester, there's a goal, there's a protocol that you can put in there to give this woman a higher like experience. I have a body cushion that has this adjustable belly area, so a woman can lay face down. And as you probably know, a lot of pregnant ladies have back pain and hip pain and all these things, and nobody can really get at it. It's really difficult unless you have this body cushion and a lot of pillows and propping. It's hard for them to be comfortable face down. So that's always really gratifying to give them some relief. And
Yeah.
yeah, and so I guess for me, it was all about just working with the emotions and, learning that there really is no failure. It's more of just like compost, it makes the soil and makes the plants richer when you have a depth of knowledge of like, I really know where you're at. I know where you know, where you are emotionally. And
Mhm.
then I can offer them something like this. I've helped women with IVF,
Yeah.
and there's this protocol that we acupuncturists have actual studies, backing it, called the Stenner-Victorin protocol. And they've actually shown that someone who has this protocol done 24 hours before and after IVF have a 65% increase in implantation.
Holy
So,
cow.
so we can help a lot with so many things.
That's an outstanding result. That's not like that's not a little bit. And
Yeah.
IVF, I mean, it's expensive, it's emotional, it's
Oh my
physically
gosh.
draining. It's I went through infertility and they said the next step is IVF. And I'm like, nope,
Yeah.
not from it's not happening. I will
Yeah.
never have children before I do that. So
Yeah.
when women do it, I'm like, bless you. I just know how hard that is to even go down that route. So I mean, a 10% increase would make me ecstatic, but
Yeah.
65 is
Yeah.
massive.
Yeah.
Holy
Yeah.
cow.
Yeah. It's very
How
traumatic.
It's
Hmm.
very traumatic. How hard is it? Well, I guess I want to, it's kind of a two-part question. I think I know the answer to the first part, but how hard is it for you to recognize where emotions are off in someone that comes to see you? And how hard is it for them to accept that?
Well, that's a really good question because I do get like the husband whose wife made the appointment and
Oh,
drives him to the appointment, and
no.
he's, on the table, and he's benefiting somehow from having that disorder or whatever pain or illness that he has because he's getting taken care of. So he doesn't really want me to fix it. And I'm just
Oh,
taking one example. There's many,
interesting.
people who benefit from whatever they are dealing with. And so I have to really be careful with my boundaries because some of these people don't want to heal and I'm not fixing them. I'm just facilitating. So I always make it very clear I'm a coach. I'm here to help you. I have a lot of knowledge. I spent most of my, adult life, younger, 20s and 30s in school. I was doing other things, but I was in school. So for 8 years after high school.
Yeah.
So, and then I had a 25-year apprenticeship with my mentor. So, it's like I have some knowledge, but I'm also very like humble in the sense that I know it's a co-creative process. They have to want to heal. And so they have to figure out, oh, I'm wearing this really heavy purse on my right shoulder, and that's why I have this chronic pain and it keeps getting re-injured. They have to figure it out themselves. I'm just there, just kind of helping, getting the inflammation down, working on the scar tissue, moving their energy, giving them herbs, helping them with their diet, just kind of helping them in more of, I see myself more as like a cheerleader or a coach.
Right.
And yeah,
I think it's so fascinating that you brought up that some people don't want to be fixed and that there's lots of reasons why, because as much as they may dislike whatever's going on, it's serving them in this other way. And that's fascinating. Yeah, you can't. I'd be the wife that would have to make the appointment for my husband and it would never do him any good. It would, I would absolutely, I'd be like,
right? It's almost
you need to figure it out on your own. I'm the opposite. I'm like, well, when
right,
you're ready, you'll
right.
either ask me for help or make an appointment with someone. And
Right.
until then, I don't know what to
Exactly.
tell you. Yeah.
Exactly. Free will. It's really about free will and consent and everyone is on their own journey. Like
Yeah.
you have to be very careful as a practitioner, to not impose your will on someone because then that can actually block their own healing process.
Yeah.
So that's something that I've thought about a lot is just, be very careful with how much you direct people, and that's such an opposite model of Western medicine, which is
Yep.
like I am the doctor god and I will tell you what to do, and you have no say and you have no ability to figure it out for yourself. So yeah, it's
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 the opposite.
it is.
It's the same thing being a doula. I mean, I think it's super important to come at things from an unbiased. It's not about what my birth was or what I want for you or how I think you should. It's like, it's never has anything to do with me. It's your
Right.
body, your baby, your family. So I'm there to make sure you have the education to make great choices, and then I'm supporting you in those choices. I don't care what the choices are. Doesn't make any difference to me what direction you want to go. Um, yeah, and that's hard. It's hard in our US mentality because there are
Yes,
lots of people, there are lots of doulas who are like, yeah, but it could be so different. Well, that's not what that person wants. You can
right.
do it any way you want. So even you're saying that you have that mentality and that's not medical, it's not. But also, I think we're conditioned in the US to do it the way we're told to do it,
Yeah,
and or to assert what we feel like is the right choice. And neither one of those are good.
right. And I love what you do. And I
Hmm.
actually looked into being like a doula acupuncturist. I thought that would
Oh
be so
my
cool.
gosh. If you want to go there, we've just
I
become referral
know.
partners. I
I
mean,
know. I'm such
so
a learning
big.
junkie. I was like, "Oh my gosh, this would be so amazing." And, I have so many tools like, actually one that I wanted to tell you about that
Yeah.
a lot of actually not a lot, but a few midwives that I know um carry this herb called Yunnan Bayao, and it's actually stops hemorrhaging.
Oh,
So it's like a totally natural way of having an emergency,
yep.
protocol, something to do. And there's other things like, I have an acupressure for pregnancy PDF that I could send it to you if you wanted to provide it for your listeners.
Yes.
And it's so amazing how just simple points can help, like these points right here are very descending points. And so when a woman's in labor, she can have her husband come and like push on these points.
Yeah.
And, of course, I'm very well versed in all the points not to do, but it's not as scary and like it's not as extreme as some people might think. You would have to do acupuncture protocols on somebody with electric stimulation to actually, I mean, that's what you do for an induction. You have to really like use these points that are contraindicated during pregnancy and then do electric stimulation on them and really like, stimulate those points. And for quite a while, actually, it takes a
Yeah.
while to do a natural induction. But the beauty of it is you don't get that, rebound effect like with Pitocin, where I've heard that women then immediately have to go get an epidural because the contractions are so powerful that it's so painful that they just feel like they have no choice. So this natural induction is another alternative that people may not have known about. Um, or like breech babies. That is like the easiest thing in the world. It's one little needle, or even moxa, which is like this heated cigar shaped roll. You just put a little heat on the tip of the pinky toe in the corner there. And all night long, the baby's like moving, moving, moving. Next morning, I get a call. Oh, baby's in the right position now.
Yep.
I just love it.
I love it too. I love that I have somebody to send clients to for this stuff because
Thank you.
these are very stressful situations for women to be with. If they're told that their baby's breech, if they are told that they need to have an induction. I mean, first, there's a lot that they have control over and deciding through all that, but also just having options. The other thing is like getting labor started when you're at or past your due date. Um, that's another huge one that comes up. I love it. I love how much you can help, and I just love how open your practice is for this for women in their reproductive years because it's so exciting. I just appreciate you so
You.
much.
Thank you so
Um,
much.
I want all your information is in the show notes. What is the best and easiest way for people to get in touch with you? You're here in the Washoe County area in
Yes.
Nevada.
hmm I'm located inside Pinnacle Wellness Spa, which is
Oh,
a holistic
yes.
spa.
Sorry, I know who that is.
Yes.
Anybody who knows who that is just clapped at the same time that I did. Yes, okay.
And I have a website, Wilder Health Acu, so wilderhealthacu.com. And people can look at my information and schedule right from the website.
Oh,
And
excellent. Okay.
yeah. And then I also have a phone number. on there so people can call me.
Excellent. It was so fun to talk to you. Thank you so much for being on and sharing.
Thank you so much for having me. Appreciate it.